For some seniors and people living with chronic conditions, staying healthy can be far more complex than simply eating right and exercise. Managing multiple medications, keeping track of day-to-day changes, and knowing when those changes should prompt a call to the doctor. Let's look at one potential patient scenario. Albert is 76, lives alone, and takes multiple daily medications, including one for his high blood pressure. His memory isn't as sharp as it used to be, so it's not uncommon that he misses a dose or two. Side effects have also been giving him some dizziness, and one afternoon he has a fall. Hours later, his daughter finds him and calls for help. He spends a week in the hospital with a twisted ankle and a concussion, and also gets examined for his dizzy spells. Then another week in rehab, while his daughter starts to work on a schedule to check in more often. Albert is back at home and feeling better, but the experience has left him weaker and worried about another fall. What if we could change Albert's story? Phillips believes there's always a way to make life better. By seamlessly connecting people, data, and technology, we can help people live healthier lives and better empower the providers who care for us. Let's see what the future could hold. Arriving back home, Albert's daughter has already signed him up online for a new program through the hospital, which comes with an emergency response pendant. Within a week, a nurse and technician visit and get him set up with devices that capture and collect his measurements, as well as a medication dispenser that alerts him when it's time to take his pills and dispenses them pre-sorted and packaged. All of which send data back to the provider, so Albert, his daughter, and his care team all have the same information. Now his team checks in regularly by video call. After getting an alert about his blood pressure, his doctor has recommended changes to his prescription. New medication for the dispenser arrives in the mail that week. Things are going well, but over time, the emergency response service notices an increase in how often Albert is pushing the button. Concerned about the trend, the service rep helps schedule a home visit from a nurse and keeps his daughter in the loop as well. Supported by his family and connected to his care team, Albert now has the peace of mind and freedom to focus on living his best life possible. Innovation and you, Phillips.